Welcome back, Chronics, and thanks for joining me. Today we're talking all about medicinal cannabis, how it can help and treat Ehlers-Danlos syndrome, the history of it, why it's such a point of contention, and then an uplifting story about a pediatric cancer case that had a nice outcome. Believe it or not, I found a case study specifically for treating Ehlers-Danlos syndrome with cannabis. This is the case. So this woman had been having symptoms since age 10. Yeah, no one could figure out what was wrong. Shocking. This poor girl was getting dislocations everywhere. She had autonomic dysfunction. She was having severe proprioception problems. She also suffered from gastroparesis. She was put on a feeding tube. Oh, and she was also having bladder spasms, so she'd have to self-catheterize every time that happened. At age 15, they had this girl on codeine and tramadol. And finally, at age 17, she did get a hypermobile EDS diagnosis. Her condition continued to get worse. Her jaw dislocated. She had to have surgery. That did not work. So now she was on morphine, diazepam, and a fentanyl patch. And because all of these painkillers affected her so bad mentally, then they put her on an antidepressant. Now, this was in the UK, and a doctor recommended cannabis to her and said you can get a special dispensation from the NHS, but they did not give it to her because, what's Ehlers-Danlos syndrome, right? So did she have to break the law? Yes, she did, and thank God for that. Within 3 days of beginning the cannabis oil, her pain was greatly reduced, inflammation reduced, and much, much less muscle spasms. After 3 months of using cannabis, she was able to go off all opioids. So regardless as to where your opinion is on cannabis politically, it did save this girl. And she's now able to work up to 4 hours a day. Before, she was bedridden, on a feeding tube, catheterized, and literally losing her mind. Cannabinoids, which are found in cannabis, also naturally occur in our body. Cannabinoids also block peripheral nerve pain. We've seen that in, animal studies, because if we did it in humans, everyone would be in jail. A little history behind cannabis. People have been using cannabis, and cannabis has been in medications for over 5,000 years. Chinese physicians almost used it exclusively. Then in 1937, the government thought that they'd put in a little Marijuana Tax Act, which basically made marijuana illegal. Right before this was the prohibition of alcohol. This one doctor was telling a story about his father. He was asked as an assignment to make a cannabis tincture. Cannabis was still legal. His professor said, make it at your own risk because you're gonna need a couple tablespoons of alcohol, which was illegal. In the 70s, it was classified as a Schedule I drug, right alongside heroin and LSD. The problem is, you can't do testing on Schedule I drugs. So guess what? You can't do testing on cannabis. This seems extremely convenient. I don't know, I'll take Big Pharma for 200. Actually, in 1974, the Cancer Institute published a lot of literature about cannabis. So mysteriously, cannabis studies were just ceased completely. However, they have seen in other countries that cannabis destroys cancer cells. There used to be about 450 articles on the web about breast cancer and cannabis, and this one woman recently went on to find them on PubMed, etc., and could only find 30 out of 450. That's weird. So we have to depend on other countries for testing. This one doctor who had been doing research for over 20 years finds that cannabis oil causes cancer cells to basically commit suicide. And when cannabis oil was put on colon cancer cells, all of the cells affected by cancer were destroyed, but none of the cells that were healthy were touched. So here's the kicker. The government says marijuana, cannabis, doesn't have any medicinal benefits. Did you know that the United States of America has a patent on marijuana? A long time ago, they found that cannabis acted as a brain protector after severe head injuries. But they don't think it has any medicinal benefit, just remember. Currently, the Attorney General is trying to reclassify cannabis from a Schedule 1 to a Schedule 3, so we can actually do testing on it. The reclassification has been approved, but there is a 60-day comment period, which has already gone past in crickets. I have a feeling they're going to drag their feet on this until after the election. We have to decide who's on whose side and who has friends in Big Pharma. Because it's actually been proven to save lives, like this baby who was 6 months old and was diagnosed with brain cancer. Her parents were reluctant to start chemo because, at 6 months old, the chemo could kill her. Doctors have told her that the chemo they have isn't quite specific for this type of cancer, but it's the best shot they have. So these parents started to research other options and came across cannabis, specifically cannabis helping in pediatric brain cancer patients. The doctors ended up adding in chemo because at first the tumor was still growing. But as soon as she was put on the therapeutic dose of cannabis, which is THC and CBD, that's in a ratio that did not make her feel high, affect her mentally in any way, just helped her. So the doctors did another brain scan after she had been on the full dose, and the tumors were shrinking. It's the cannabis, marijuana, the sticky icky, shrinking tumors. This little girl's large brain tumor shrunk from 4 to 1 centimeter, and the smaller one is completely gone. She still continues treatment, but now she's 4 and just had her first dance recital and is doing really, really well. You can ingest cannabis in many ways. You can eat it, you can drink it, you can vape it, you can vape the dry flower, you can use cannabis oil, topical CBD, THC. You can put it in drinks. Literally any way it can be administered, it has a product. As always, thank you for joining me, Chronics. I hope this episode enlightened your mind, and if this is something that will help you, I definitely encourage you to pursue it. As always, stay strong, hang in there, and don't take crap from anyone, okay? I will see you next time.